Okay, last call. We're going to start back up again. Your bonus prize for coming in and sitting down is that this is the last time you will hear from me. It's the last time I will shout at you. Not ever, I just mean for today. You'll probably hear from me again, but I mean just for today. I will not shout at you again. I'm going to give it back to Leigh, who won't shout.
I actually have I'm very soft-spoken, so I have to get Bridget to do the dirty work. Sorry, Bridget. All right, so now we're going to move to our final panel, and we're going to talk a little bit about, okay, so now we've talked about evaluation, not enough, obviously, but for today, it's been enough, I think. And now let's talk a little bit about what do we do with the learnings and what do we do with the evaluation. How do we use what we've learned to drive change in the real world for real live human beings. So how do we use evaluation and learnings from evaluations to drive how we invest, how we go about our own work when we go back to the office, how we change policies, change our own behaviors in our communities. So let's talk a little bit about this now. We'll sort of divide this into two parts, and for the first part we'll hear from a panel and we'll talk a little bit about the steps in between evaluation and change. So we'll hear their reflections on the day and how they see evaluation impacting the work that they do in health and wellness. And then we'll sort of open it up to all of you and talk a little bit about next steps for this group and the people in this room who are really excited to do things and move things forward. What do we do next after today? So first, I'll just introduce our moderator, and Maggie Hawthorne is a very good friend of the IOM. She used to work with us at the IOM on the evaluation of the PEPFAR Global HIV/AIDS Initiative, and now she is the Senior Manager for Planning and Performance Improvement with the Camden Coalition of Healthcare Providers. So over to you, Maggie.
Great.